at my old institution, our professors used to say there are 3 things we do in the hospital. The first is take care of patients, and the second is learn, and the third is have good fun. And I think we do a great job at the first, and we usually do a pretty good job at the second, but when we're talking about each other, the community of the hospital or the community of the intern experience, it's usually as like comrades in arms. It's usually like, well, I've got a great community because if I get sick, somebody will cover me, or if I'm having a bad time, someone will take the bullet for me. It's always in that kind of language. It's freighted with the term of sacrifice defining one's community, which is true and in part. But he says, but we're not having a lot of fun, it sounds. No one's talking about having any good fun. And, not that the thing is all fun, but that's one of the defining features of our profession. And if you look at our great professional giants like William Osler, he had great fun on rounds, Osler had great fun on rounds. There were practical jokes amongst themselves. He would ornament his language so that a patient wouldn't come in and you'd say, this is a 46-year-old alcoholic who's come in with presentation of the same. Because by saying that, you've already framed this person as, they're an alcoholic, or this is a 27-year-old homeless person with a blank venereal disease, or this is a 72-year-old 250-pack-year smoker who's come in with COPD, right? You frame them, and it's important to frame them, but you also, in that very Foucault-like way, you've now extracted their humanity from them, which you need in part in order to maintain the clinical gaze, but in order to treat the patient as a person, which is what they are, you can't have just that. And so Osler would do things, instead of saying that they were an alcoholic, it was, this is a 46-year-old devotee of Bacchus. And everybody knew what you meant, right? Because everybody had this shared experience of, Bacchus is this Greek god and all the revelries, and we were aware of that. So now you've elevated this man from an alcoholic, as the pejorative value comes with that word, to now he's a player in a mythic game. Or some so-and-so with ex-venereal disease. They are an advocate of Aphrodite, or those kinds of things. Everybody knew what you meant. Everybody knew you didn't lose anything for translation, but it made the expression of medicine, which is mostly a verbal act. We go on rounds for hours and hours, and we talk about things. We take a history, a story of the patient. And part of that, if it is charged with certain terms, can be negative or positive. And in this way, you would elevate it. So that's in the milieu, and yet we've come very far from that. That's out of it's in the water.